If you or someone you love takes a pill every morning for blood pressure, I need you to stop scrolling for the next few minutes, because what I'm about to share could quietly be changing how your body works without you even realizing it. Amlodipine, Losartan, and Lisinopril are three of the most prescribed medications in the world for high blood pressure, and millions of seniors take one or even a combination of these every single day, trusting that as long as the numbers on the blood pressure monitor look good, everything underneath is fine. But here's what almost nobody tells you at the pharmacy counter, and what most doctors don't have time to explain during a rushed 15-minute appointment. These medications, while genuinely life-saving and effective at controlling blood pressure, can also produce a set of subtle, slow-moving side effects that creep in so gradually that people mistake them for normal aging, for tiredness, for just getting older. Swollen ankles get blamed on standing too long. Brain fog gets blamed on a bad night's sleep. A persistent dry cough gets waved off as allergies. But when you start connecting the dots, a very different picture emerges, one where the very medication meant to protect your heart may be quietly reshaping other systems in your body. Today we're going to walk through 6 of these silent side effects, what's actually happening inside your body when they occur, and what questions you should be bringing to your next doctor's visit. This isn't about fear, and it isn't about telling you to stop your medication, because these drugs remain essential tools for preventing strokes and heart attacks. It's about awareness, because the earlier you notice a pattern, the earlier you and your doctor can adjust course together. Let's start with the one almost everyone on amlodipine eventually notices but rarely reports, and that's swelling in the lower legs, ankles, and feet, medically known as peripheral edema. Amlodipine works by relaxing and widening blood vessels, which is exactly what lowers blood pressure. But that same relaxation can cause fluid to leak out of small blood vessels into the surrounding tissue, especially in the legs where gravity pulls fluid downward throughout the day. Many seniors notice their socks leaving deep indentations by evening, or their shoes feeling tighter than they did in the morning, and they simply chalk it up to sitting too much or eating salty food the night before. But when this swelling becomes a daily pattern, it's worth paying attention to, because persistent edema can also mask or complicate other conditions, including issues with kidney function or the heart's ability to pump efficiently. The tricky part is that this side effect doesn't always show up right away. It can take weeks or even months of being on the medication before the swelling becomes noticeable, which makes it easy to miss the connection entirely. If you've started a new blood pressure medication in the past few months, and you've also started noticing your ankles look puffier by the end of the day, that's a conversation worth having with your doctor rather than a symptom worth ignoring. The second silent side effect involves lisinopril specifically, and it's one that causes more unnecessary suffering than almost any other medication-related symptom, and that's a persistent, dry, tickling cough that seems to come from nowhere. Lisinopril belongs to a class of drugs called ACE inhibitors, and these medications work by blocking an enzyme that not only affects blood pressure, but also plays a role in breaking down a substance called bradykinin in the lungs. When bradykinin builds up, it can irritate the airways and trigger a cough that has nothing to do with a cold, allergies, or a respiratory infection. What makes this particularly sneaky is the timing. This cough doesn't always appear the day you start the medication. It can develop weeks or even months later, which means many seniors and even some doctors don't immediately connect it to the pill they've already been taking safely for a while. People often end up cycling through cough syrups, allergy medications, and even chest x-rays trying to find an explanation, when the real answer was sitting in their morning pill organizer the entire time. If you've developed a cough that lingers for weeks, doesn't produce mucus, and doesn't respond to typical cold remedies, and you happen to be on lisinopril or a similar ACE inhibitor, this is absolutely worth flagging to your physician, because there are alternative medications, including Losartan itself, that treat blood pressure through a different pathway and typically don't cause this same cough. Now let's talk about something that affects quality of life in a way that rarely gets discussed openly. And that's fatigue and a subtle sense of mental slowness that many seniors describe as just not feeling like themselves. All three of these medications, Amlodipine, Losartan, and Lisinopril, work in different ways to lower blood pressure. But a side effect of lowering blood pressure too effectively or lowering it too quickly is that the brain can receive slightly less blood flow than it's used to, at least until the body adjusts. This can show up as tiredness that doesn't improve with rest, difficulty concentrating, or a kind of mental fogginess that makes simple tasks feel more effortful than they used to. Because fatigue is such a common and vague complaint, it's incredibly easy to attribute it to age, poor sleep, stress, or simply having an off day, and most people never think to connect it back to their blood pressure prescription. The important nuance here is that a small drop in energy when starting a new medication can be a normal temporary adjustment period. But if fatigue or brain fog persists for months, intensifies, or starts to interfere with your ability to drive, manage finances, or engage in conversations the way you used to, that's not something to quietly accept as the new normal. It's worth having your blood pressure rechecked at different times of day and discussing with your doctor whether your dosage or timing needs adjustment. Because sometimes even a small tweak in when you take the medication can make a meaningful difference in how alert you feel. Before we move to the next side effect, if you've made it this far, I want to ask you to do one small thing that genuinely helps this channel keep making content like this. Hit that subscribe button and tap the notification bell, because every week we break down topics just like this one, the things about your health and your medications that rarely get explained clearly. And having you as part of this community means these videos can reach more people who need this information but haven't found it yet. It takes 2 seconds, it doesn't cost you anything, and it makes a real difference. Now let's continue. The fourth silent side effect is one that particularly affects older adults, and it involves changes in kidney function markers, specifically with Losartan and Lisinopril. Both of these medications work in part by affecting the renin-angiotensin system, which plays a central role in how your kidneys regulate blood pressure and fluid balance. For most people, this is a beneficial mechanism that actually protects kidney health over time, especially in people with diabetes. But in a smaller subset of seniors, particularly those who are also dehydrated, taking certain other medications like diuretics or nonsteroidal anti-inflammatories, or who have underlying but undiagnosed kidney issues, these blood pressure medications can cause a measurable rise in creatinine, a marker that reflects how well the kidneys are filtering waste from the blood. This usually doesn't cause any symptoms you'd notice day to day, which is exactly why it's called silent. You won't necessarily feel anything different, but a routine blood test might reveal a subtle shift over time. This is precisely why doctors recommend periodic blood work for anyone on these medications long term. Not because something is wrong, but because catching a small change early allows for a simple adjustment before it becomes a bigger issue. If it's been more than a year since your last kidney function panel and you're on one of these medications, that's a very reasonable thing to request at your next appointment. The fifth side effect is one that tends to fly under the radar because it's often mistaken for a normal part of getting older, and that's a drop in potassium, or in some cases with Losartan specifically, a rise in potassium levels that swings the other direction. This might sound confusing because different medications in this category can push potassium in different directions depending on how they work. But the underlying theme is the same. These drugs interact directly with the electrolyte balance your muscles and heart rely on to function properly. Low potassium can cause muscle cramps, weakness, or a feeling of heaviness in the legs, while elevated potassium, which is more specifically associated with Losartan and other angiotensin receptor blockers, can cause an irregular heartbeat, unusual fatigue, or, in more serious cases, changes in heart rhythm that require prompt medical attention. The reason this qualifies as silent is that mild shifts in potassium often don't produce dramatic symptoms until they've become more pronounced, and seniors frequently attribute early symptoms like leg cramps at night to simply being an older adult, rather than a sign worth mentioning to their doctor. If you've noticed new or worsening muscle cramps, especially at night, or any sense of your heartbeat feeling different than usual, A simple blood test can check your potassium levels and rule out whether your medication needs any adjustment. The sixth and final silent side effect we're covering today is one that affects intimacy and self-esteem more than physical health directly. And it's rarely talked about because of how private and sometimes embarrassing it can feel to bring up, and that's changes in sexual function, which can occur with amlodipine and to a lesser extent with the other two medications as well. Blood pressure medications work by affecting blood flow throughout the entire body, not just in the areas we typically think about, and this can sometimes lead to reduced circulation in ways that impact sexual performance and desire. For many seniors, this side effect goes completely unreported to their doctor, not because it isn't bothering them, but because there's a lingering sense of awkwardness or embarrassment around bringing it up, especially in a short appointment where it can feel like there isn't room for a personal conversation like that. This silence does a disservice to patients, because in many cases, simply switching to an alternative medication within the same class or adjusting the dosage can resolve the issue without compromising blood pressure control at all. Your doctor has almost certainly had this conversation many times before, and bringing it up isn't awkward for them the way it might feel for you. It's simply part of managing your overall health and quality of life, and it deserves the same attention as any other side effect on this list. So where does this leave you if you or someone you care about is taking amlodipine, losartan, or lisinopril? The goal here isn't to create anxiety about medications that are, for the vast majority of people, both safe and necessary for preventing serious cardiovascular events like stroke and heart attack. The goal is to help you recognize that swelling in your ankles, a persistent dry cough, unexplained fatigue, subtle changes revealed in blood work, muscle cramps, or shifts in intimacy aren't necessarily just signs of aging that you have to silently accept. They might be your body's way of signaling that something about your current medication regimen could use a second look. The best thing you can do is start paying closer attention to your own patterns. Keep a simple note on your phone or a notepad of anything that feels different since starting or adjusting your medication, and bring that list to your next appointment rather than waiting to be asked. Doctors can only address what they know about, and you are the only person who experiences these subtle changes day to day. Please remember that I'm sharing general health education in this video, not personalized medical advice, and you should never adjust, stop, or change any medication without first speaking directly with your doctor or pharmacist, since abruptly stopping blood pressure medication can itself be dangerous. Every person's body responds differently, and what applies broadly may not apply to your specific situation. So use this information as a starting point for a more informed conversation with your healthcare provider, not as a replacement for their guidance. If this video helped you understand your own medication a little better, or gave you something to bring up at your next doctor's visit, do me a favor and subscribe to this channel before you go. This community exists because people like you decided this information was worth sharing, and every subscriber helps this channel keep producing videos that translate confusing medical topics into something clear, honest, and genuinely useful for you and your family. Hit that subscribe button, turn on notifications so you don't miss the next video, and if you found this valuable, share it with a parent, a spouse, or a friend who might be dealing with the exact same silent symptoms without realizing why. Thank you for watching, take care of yourself, and I'll see you in the next one.